I'm happy to introduce Teresa Mitchell. Teresa is going to speak about the management of side effects of treatment, which is obviously a very important issue for many folks here. Teresa is a registered nurse at the BC Cancer Agency, Vancouver Centre, and where she began her career in the ambulatory care chemotherapy unit. And for the past year, Teresa has worked in the clinical trials department as a nurse coordinator for kidney cancer patients who are participating in clinical trials. Teresa?
Hi. So you've already heard from Dr. Comensberger about the different treatments available, and he repeatedly mentioned that the biggest challenge with being on treatment is managing your side effects. So I'm just going to go over those with you today. Just some tips on what to do about them and how to keep yourself on treatment as long and as safely as possible. So prompt attention to the side effects is the key to optimizing your treatment. We know these drugs work, but they also can be harmful to you as well. So you need to pay attention, you need to know what to do, and you need to stay in contact with your healthcare team. So these are just some of the common side effects that are reported: fatigue, diarrhea, nausea, vomiting, mouth sores, lack of appetite, taste changes. There are a few different skin toxicities that we see. They can decrease your blood cells, cause a headache, and even elevate your blood pressure. So fatigue is number one. Up to 75% of patients report fatigue, and to be honest, we don't even know why that is in relation to the drug, but there are other things that can come into play, and that can include your diet. So optimize your nutritional intake, stay hydrated, get your food in, make sure you avoid dehydration, electrolyte imbalances, and control your pain as well. You should not be in pain. Use your pain medications. If you're having trouble, speak to your doctor or your nurse to help you figure out how to manage that better. You could be anemic, and that's something that we keep an eye on as well when you're coming in for your appointments. Depression and stress is big, especially in the beginning. You are faced with a cancer diagnosis. This is new. You don't know what the future holds, and sometimes you need a little bit of help getting through that hump. Also plan and prioritize yourself. You don't have to accomplish everything in the same day, so make small goals for yourself. We do also know, and Deb touched on this morning, that exercise is a proven way to combat your fatigue. So it seems like the opposite. If you're tired, you want to lay down and rest, but actually keep yourself active and stick to your normal routine will actually benefit you. Some patients report nausea and vomiting, and it's important to keep eating and drinking often throughout the day. So a lot of people find that after a large meal is when they feel most nauseous, so don't eat a large meal. Eat small meals often. Drink plenty of fluids as well, and this is important to know. You don't have to drink 2 liters of fluid all within the first couple hours of the day. Spread it out over the day, 6 to 8 cups of water, and it doesn't have to just be water. Actually, you can have milk or juice, as was mentioned this morning. Broth is good as well. 6 to 8 cups over the course of a day is not that difficult to fit in, which is easy for me to say, I understand. We also have medications that can help if it is uncontrolled, and you can take these as prescribed, and they do help, and they help with your appetite as well. A lot of patients prefer to take their drug in the evening. Eat your dinner, take your medication, stay upright for a little while, make sure that it's actually going down, and then get to bed. And a lot of people find that they can actually sleep through the biggest part of that nauseating feeling. Some people have sore mouth. Now this can actually range from a slight feeling of hot or burning sensation in the lining of the mouth to full-on open sores. And sometimes it depends on which drug you're actually taking or how far it has progressed before seeking treatment. So some things that you can do ahead of time before they show up is make sure you're brushing gently with a very soft toothbrush. Brush the tongue and the teeth, and multiple times a day as well. Using a baking soda mouthwash can be helpful, and avoiding irritating foods and liquids. So hot coffee, carbonated beverages, spicy foods, especially once the soreness does show up, these things will really affect you. Keeping your fluids up is a recurring theme as well. If you're dehydrated, your mouth is dry, and can cause this soreness to come about as well. If you're having trouble, make sure you call us. We do have a mouthwash. Works so well, we call it Magic Mouthwash. You use that for a couple of days and it usually clears right up. Diarrhea, reported by about 50% of patients, can be the biggest reason for requiring a dose reduction or a change in your schedule. So if you have diarrhea, you do need to keep eating and drinking, but only in small amounts. Give the digestive system some time. And have Imodium on hand. So even though only 50% of patients are going to have diarrhea, I don't know which one of you guys it's going to be. And I don't want it to be 2 o'clock in the morning on a Wednesday night when you've got this diarrhea coming on. You won't get to a pharmacy in order to get the Imodium. So have it in your cupboard just in case. Diarrhea is defined as an urgent watery bowel movement, and you should take 2 Imodiums at the first onset of your diarrhea and 1 pill with each movement after that until it stops. And these are just the directions that are on the box. So I'm not giving any special fancy directions. Just treat the diarrhea as you would on the box. Now a lot of patients say they don't want to take Imodium because it'll make them constipated. Which is true, it probably will, but at that point we can deal with the constipation. Right now the diarrhea can be dangerous and it needs to be dealt with. Dehydration, if continues, even renal failure as a worst case scenario. So don't be afraid to use that Imodium. Lack of appetite is reported by some patients. It doesn't really require any change in treatment at all, but it can be distressing, mostly because food is such a social and fun thing for a lot of people. So you have to put yourself on a schedule. If it's lunchtime, you don't feel like eating, you know you haven't eaten since early this morning, you have to have something to eat. You have to keep your nutritional intake up for your energy as well. So eat your meals small and frequent throughout the day, and keep snacks readily available for you around. Keep a bowl of nuts or something else that you enjoy in the area to keep up that unconscious eating, which most of us try to avoid at this point, before we're faced with this. Now, you heard this morning from Linda, the dietitian, that you wanted to avoid high protein and high calorie things, but her talk was for people who did not have any cancer problems or were not on treatment for their cancer. So the game changes now. If you're not getting anything in, you have to maximize that potential. So if you drink milk, drink whole milk, not skim milk. If you like yogurt, eat the full fat yogurt, not fat-free. It's also important to make sure your caregiver is aware of these things to help you. If you're a person who comes into your appointments by yourself and you report these to us and we give you ideas of how to deal with that, you need to communicate that to your family as well if they're at home and being the ones that are helping you. Taste changes kind of ties in with the lack of appetite because the foods that you used to like don't taste good anymore, so you don't want to eat them. So if you can experiment with different flavors of food, try different spices, things that you never used before, you may actually find something new that you enjoy. And if there are certain foods that don't taste good, don't eat them. Find something else that does. If you brush your teeth and tongue often during the day, it can help that metallic taste diminish a bit, but be gentle, of course, keeping the mouth sores in mind. And try eating foods at your different temperatures. So sometimes it's cold foods that people don't like, or sometimes it's hot foods that people don't like. And this will be individually for you. Skin disorders. Now, there are actually a number of different things that can happen with the skin, ranging from a general dryness over the entire body or scalp to actually red rash to a hand-foot syndrome, which Dr. Komensberger touched on earlier. So for dry skin, you want to just use lotions. We do recommend certain ones, and there's one in your green bag today, the Utterly Smooth. And I've also heard of other nurses recommending Head & Shoulders shampoo as a body wash can help with dry skin as well. Sometimes the rashes can be soothed with lotions, but if they get too bad, you can let us know and we can prescribe a cream as well. Your hair can change color on some of these drugs, and it happens on the schedule. So you're on drug for 4 weeks, your hair will grow white. And you take a 2-week break and then that hair will grow dark. So if you actually pull a strand of hair out, you'll see this line of dark and white. skin color, some people actually turn yellow, and not like as yellow as a banana or flowers that are on your table, but a slight tinge, and that's because the drug, once metabolized in the body, actually is yellow and gets taken up by the skin. So hand-foot syndrome is its own problem altogether. You'll notice the palms of the hands or soles of the feet can become red and sore and develop actually into blisters that will open and be quite painful. So you want to use thick creams, and you can do this before any onset of this happening. Keep your skin well moisturized, and any creams that have lanolin or urea in them are helpful, and make sure that they're fragrance-free. None of that fancy stuff. Just go for a thick, plain white cream. If you use liquid soaps instead of bar soaps, that can be less drying as well. Now, if you do have this hand-foot syndrome, you need to let us know, and we would probably recommend that you take a little break from treatment just to let those heal up before restarting again. Blood pressure can rise. Most of our patients actually come to us on blood pressure medications to begin with, and we would want to make sure that your blood pressure readings are optimal before we even start treatment. So having a blood pressure monitor at home that you can take your blood pressure every day is helpful. Keep a log and bring it in to show us, and it usually just requires us having to change your medications a little bit. But know also when it is important for you to call in. So based on your baseline blood pressure reading, we can tell you how high is too high, and I wouldn't want you waiting until you come back in 4 weeks to tell us that for the past 3.5 weeks your blood pressure has been, so high. These drugs can decrease your blood cells, specifically your white blood cells, which are your infection-fighting cells. So this puts you at risk for infection, and hand washing is really the best way for you to prevent infection. And that goes for you and your family members and people that are visiting. I would never ask you, though, to avoid crowds. If you have tickets to a concert or a hockey game, please go to that. But when you get home, just wash your hands. You also need to have a thermometer at home. If you feel unwell, take your temperature. 38 degrees or higher is the magic number, and you need to call us. If it's the middle of the night and your temperature is continuing to rise, you're continuing to feel unwell, you can go to an emergency room, tell them you're a cancer patient on treatment with a fever, and you get straight in with special treatment. You won't sit in the waiting room for many hours. Platelets are your blood clotting cells, and those can also decrease, causing a risk for bleeding. So you want to make sure that you know what are the signs of excessive bleeding. Some of those can be blood in the stool. It might even be bright red or black, which just indicates the bleeding is occurring higher up in the GI tract. Excessive bruising. Sometimes a bit of a red speckled rash can show up. It's not raised or itchy at all, just looks suspicious. Any of these signs you'd want to call in to us again, and or if it was really giving you trouble, speak to an emergency room. Headache can happen, and don't wait till it gets really bad. If you have a headache, take a Tylenol or an Advil or whatever seems to work for you. And actually some patients can find that there are certain triggers for them, and they know what's going to make it happen. So if you can, avoid those situations. Otherwise, just make sure you know how to treat it. Now, I want you to all be aware that when you come to the clinic, you see your oncologist. He writes you a prescription, and you leave with your pills. But there's actually a whole team available to you and that you should be able to take advantage of. So you see your oncologist. We have nurses available. I'm a clinical trials nurse, so patients that are on trial have me specifically, but people who are not on clinical trials do also have access to nurses, and you can request to see one at your appointment if you're having trouble with side effects. We do have nutritionists who can help you with appetite changes or any problems with nausea or trying to find the right foods to eat. We have counselors, and they can help you with psychological issues dealing with cancer diagnosis. They can help your family members as well. It's not just for the patient. Pharmacists, we actually have a patient line for our pharmacy, and you can phone and talk to them about interactions with other medications that you're taking, or perhaps if you want to clarify the dosing and the way you're taking your drug. And when appropriate, some patients will have a home care nurse, which is a great resource for them as well. And if you are referred to home care, please embrace that nurse and allow her into your care because she has a lot to offer. So patient information, in some of these slides I had in quotations these handouts, and these are all available at the BC Cancer Agency. And for patients that are being seen at some other sites, you can still get these at our library, which is located across the street from us in Vancouver. There is also tables at the back that have similar pamphlets in helping to cope with nausea and diarrhea, and the Canadian Cancer Society has booklets back there as well. So after hearing all that, who would want to take these drugs? Certainly not me. But when you listen to Dr. Koensberger and Dr. So talk about the reason why we're using these drugs, it makes sense. And not everybody will experience every single one of these side effects by themselves, so right, all at the same time. So you need to know that each patient is unique, and each patient will respond differently to these medications. We know that side effects are good, so be happy that you do have some side effects, but also know how to treat them. And use your healthcare team to your advantage. We send you home for 4 weeks, but doesn't mean you're alone for 4 weeks. You can call us and speak to us about how to treat these problems. So the key to optimizing your treatment is to stay on drug, and you can only stay on drug if you're taking care of your side effects. A lot of patients ask, what can they do on top of their treatment to increase their chances of survival? And you heard this earlier as well when Dr. Norris talked about complementary therapies. And the truth is we don't know. We don't have any evidence to say that this particular food or this particular supplement will increase your survival. What we do know is if you stay on drug and manage your side effects, that can increase your survival. So some takeaway points is to continue your exercise, maintain a balanced diet as much as possible, stick to your normal routine, try every day to do the same things that you used to do and used to enjoy. There's no reason that you have to give those up, and if you can stay on treatment, we can treat this more as a chronic disease rather than a terminal illness. Thank you.